Yeah.
Yeah.
Yes.
Well, no, there's a few I don't like.
I like arms.
I don't like arms.
Neither do I.
Yeah, no, I don't like arms.
So your patient is kind of positioned the same way that they would be for a venous, since they're following the same path.
Right. So obviously you're going to go transverse to start, so you can just find, right, your vessels, yes? And you're looking for them the same way that you would look for the vein. So there's the vein. And so see how you can see saphenous vein there? Everybody see that? Say no if you don't.
Yep.
But it's right here, right? Going into the what?
Common femoral.
So this is common femoral artery, right? So I found my spot. Now I'm going to turn, okay? And I want...
Is that her vein doing the like? Yeah.
moving.
That looks
Yeah.
so cool. It's like the same as her breath.
Yeah.
That's
That's usually what veins do, right? I'm just saying.
I am too.
So now I'm angling up a little bit so I can get up high on this CFA. So you would get a nice. Oh, I hit something. Just get it up. And so you would just take along. So you do black and white, color, Doppler. Okay? Easy. Color. You're going to steer whoops, the other way. There we go. Should try. Down. You want it to fill the box, but you don't want it to overfill. Okay, that's like bleeding into the surrounding tissue. So you want to keep it so that it kind of stays within the vein. And then you would take that. A lot of times you have to cine back because your vessels are going to be like triphasic. So the color is going to look triphasic. You're going to get red, blue. So it's hard to like catch it in red. So you just take it and cine back to get a nice red picture. And then you're just going to do Doppler. So you want to put it in the middle of the vessel. Yeah. So see how it's like triphasic? Okay, and that's the way it should be. So you don't really want your baseline like really far down because you don't want to not show that, okay? Because this is normal flow for your legs and that's what you want, okay? And then you measure peak systolic and diastolic, okay? And obviously if you're in the right preset for especially the newer machines, it's gonna do it automatically for you, all right? Okay, so common femoral, and then the same thing happens with the veins. It's going to bifurcate. There's a deep femoral artery or profound artery, and then your just superficial femoral artery or just plain old femoral artery. So I'm changing my steer box now as I come down. Take that off. And I'm
on the protocol on the board, it says that they start at external iliac. Do we need to show them that one too, or are they starting at the common?
So I have to say that most places They start at common.
That's what I've seen too.
Yeah, yeah. So, and now you're just going to follow. Obviously, if you lose your spot, just turn. Again. And now you're just going to follow your femoral artery down. Okay. So, and you're going to do the same thing. Prox, mid, distal, black and white, color, Doppler, all the way down. All right. And you follow it the same way that you would follow your vein. Then you're going to go behind the knee. And probably here too, you probably want to go transverse so that you can just find the vessels. Okay. So here's the vessels here. So now which one's the artery? The top or the bottom one? Huh? Right, because the vein is on top. Very easy to tell. You just press, right? Okay. But then you're going to turn on it. And then here's your pop. Okay. Same thing. Color. Now it's kind of facing in that direction, so I want to turn my... So see how I just changed my gain, okay? Always make that the first thing, because usually that's the thing that is, and again, see how it's, even on color you can tell it's triphasic, right? Mm-hmm. Okay, so you do that to get a nice color picture, and then you put Doppler on. Change your scale, because as you go down, the velocity is going to kind of be less. It's higher up top, and it it gets less as you go down, but it's still triphasic. And that's the other thing. So see how my Doppler started getting bad? Instead of like messing with all the buttons, most likely thing is you slid off the vessel. So just update and make sure you're still on the vessel and just do it again, see? Because a lot of times I see that you're doing this and then all of a sudden it gets bad. Well, I just slid off of it on purpose. But instead of trying to like change all this stuff, no, just update and go back, okay? Don't keep trying to change it. So again, triphasic flow. We'll measure it for you. And then...
and if it does measure it incorrectly and you need to move where the calipers are, there's a little button that you press on your touch screen. It's like the far right knob. You would press it and it says cursor, and you can move that cursor.
Because if you have a really clean Doppler, it's going to measure it correctly. But if you have somebody with stenosis and maybe there's a lot of turbulence, and, you're not getting that clean Doppler, a lot of times it doesn't really know where to measure it in it. So now kind of just following it down, okay? And so, see, it's going to bifurcate. And so when it bifurcates, it's going to bifurcate into the anterior tibia and the posterior tibia. And then if you go, and then it goes a little bit further down in the posterior and the perineal bifurcate. But so we've gotten down to the bifurcation, okay, which is nice. So if I want to follow one of these, okay, and I'm following the one that's so again, now we're going to be looking at tiny vessels, okay? So you really have to see how I just turned my what gain down? Overall, because if you have this too high, okay, a lot of times it makes it hard to see your color, okay, because they're competing with one another. So you want your images more on the dark side so that the color shows up. Does that make sense? Okay. So now this is because I'm on her medial side. This is, I always screw this up, anterior tibia? No, posterior tibia. A posterior tibia artery, okay? So you're, same thing, you're following it down. Now, they might want, again, a proximal, mid, and distal of this. Some only ask for one, some just want a distal one, okay? But you should follow it down because you never know where you're gonna see. But see how I'm just following it? All the way down. And then, so those are the veins there. See the one vein? See, there's actually two, right? So there's two posterior tibia veins, two anterior tibia veins. So when we learn about the rest of the veins, those are things that we look at too. Right now we're just worrying about the artery. So I'm just following it all the way down, making sure she has no clot, no plaque. I'm actually running out of gel here. So, and at some point I would do the same thing. I would take, and here again, as far as ergonomics goes, as you're going down, you need to move your, I'm not gonna do it because it's loud, but you need to push this down so that you're not doing what I was just doing, this kind of leaning forward and stuff, okay? Because again, you guys have pretty good anatomy, but on some people it gets a little bit hard and it takes a while. This exam can sometimes take some time to do. Oh, that's not what I wanted. So what kind of flow you're seeing now? Huh? What?
Biphasic.
Biphasic, right? 2. And this is typical as you're going down the leg, okay? It just goes kind of from the triphasic to biphasic, but it's still fine, still normal. Again, it's gonna be lower velocity as you go down. Again, normal, obviously. You got so much blood in as you're going down the...
You're just getting further from the heart.
Correct. So again, this is normal, okay? And so you would follow that down as far as you can. And you go on the other side, look for the other one. So if I'm not following it from the top, kind of like what I do with the arms is I tend to go down by the ankle and try and find it. Way. And here we go. And then you would do it the opposite way. You would follow it up, okay? That makes sense? So I just think it's always easier to find them by the ankle and work your way up, just like I think it's easier to find the radium ulmus down by the wrist and go up. And so you do anterior tibia, posterior tibia, and then the last one that we do is the dorsalis fetus, which is a very superficial vein, artery. I keep forgetting. Huh? On the top of the foot. This is the one you're hoping that when you go up to do the patient, some nurse or some doctor has come by with their little handheld Doppler, continuous wave Doppler, to listen for the artery and put their little X so that you kind of know where it is. So,
And because it's so superficial, she kind of put a nice amount of gel there, kind of like a little fake standoff pad like we were talking about, so you see it a little easier.
Don't push it
Not
down.
squishing it down.
yeah. So the one thing I am going to do is I'm changing my frequency, which you always want to do for these. You have to get the highest frequency that you can, okay? Because it's so superficial. So on that machine, I would definitely be using, you know, the higher frequency transducer. And so a lot of times when I'm doing a patient in the hospital setting, most have like the higher frequency. So I might not use it to start with, especially if a person has a big leg, because you are doing deep here. But when I get down to here, I just change my transducer so that I can.
Do you change frequency on this machine?
On there.
On this one?
So see right here. It says frequency. So see. Huh?
I was trying to change it for gallbladder yesterday and I couldn't find it.
Yeah. So you have to make sure you're just in plain 2D. If you have anything else going on, like see, I had the measurement. You don't see it now. Okay. You have to be out of everything else. You can't be in color. You can't be in anything else, or it won't be there.
Because there's different settings when you're in color. There's not.
Right. Right.
So you're finding it in Sag, you're not finding it in transverse?
Yeah, it's too small. It's too small to find the trans.
Oh, wow.
Yeah, it's too small. You don't even bother trying to find it in transverse. But look, there it is, right
wow.
there.
Okay.
Okay. So kind of right on top of the foot is where it's going to be. Okay. And again, you would just,
Put an X on Lauren.
huh?
Put an X on our foot.
Yeah. Oops. So again, very easy to slide off of this. So see how my fingers are like on her foot. There's no way you can be doing this and trying to stay on this thing and not to be pressing, because you can't really be pressing at all because it's so superficial.
So you know how I sometimes say use your pinky kind of like as
Yes.
an anchor, or a couple fingers as an anchor, it's just to help you from slowing you off.
So I'm not doing everything totally correct. So I would be changing the gate because it's kind of big. Okay, and but there it is. Okay. No stenosis for you.
Okay.
Okay.
Yeah.
And again, you should see, biphasic flow. Okay. All right. So.